Hi friends, Dr. Lisa here, and today I want to talk about ways that you can modify any exercise that you might be having some pain with. So there's lots of ways that we can look at it, but here are 3 ways that I always look to break down an exercise to help a client be successful and gain strength and recover from an injury or improve from their baseline status. So number 1 is if you're doing an exercise, we'll say a squat for example, and you're getting down into position with your weight, and you're having pain with that. And option 1 is to decrease the load. So we're going to do the same exact exercise, but with a lighter load. And that can be less weight, or it can even go to body weight if it's a body weight exercise. You can always take it down to no weight. So you repeat the same exercise with a lighter load, and if that's tolerated better, then you start there. You change the exercise to go there. Option number 2 is to change the range of motion, the depth of the motion, how much movement you do so that there's less motion in the joint. Now, one way to do that is to bring the floor up to you. So I have 2 yoga blocks stacked here. I'm doing my squat. Yoga block stops how deep I go into my squat. And that might be better tolerated if I'm not going into a deeper range of motion. So one way is to do that. The other, for this version, would be to bring the seat up into a higher position and see if that isn't tolerated better. So those are 2 ways to change the range of motion. If we're doing an arm exercise, maybe we only come up halfway, so we can change the range of motion there versus the full one, or halfway if we're coming overhead. So there's lots of ways to modify the range of motion. Now, the third way doesn't involve equipment, but it involves the volume. The volume of exercise is how many repetitions you're doing, how many sets of that exercise you're doing, and how frequently you're doing it per week. So I recommend if you have an exercise that's irritable on a joint, that you take it to once a week. And then I recommend that you reduce the number of sets and reps. So back to 1 set and to a number of repetitions that you can do without pain or with very little pain, pain that's really tolerable. We all have a little discomfort from time to time, but you know your body well enough to know a pain that is safe to work with and a pain that you should pull back from. So work within a range, lower load, lower range of motion, decreased volume, and then watch that joint and tissue begin to feel better, become decreased in inflammation and pain, and heal faster because you didn't quit moving, you modified moving so that you can continue to get good blood flow and circulation to that area, and you get back to things faster. Hey, thank you so much for watching. I'm Dr. Lisa. I'm a physical therapist and a specialist in working with older adults, and especially people with osteoporosis that are trying to protect themselves from falls and fractures and live big, bold, brave lives, staying independent and active for as long as possible. Thanks for watching. If you like this content, please give me a subscribe below and share this with others who would appreciate it.